When does low blood pressure become dangerous? Low blood pressure, hypotension, is a condition in which blood pressure readings fall below 90/60 mmHg. For many people, low blood pressure may not cause any symptoms and does not affect their quality of life. However, in some cases, it can become a serious health issue and may even pose a life-threatening risk. 1. When low blood pressure comes with symptoms. Although low blood pressure may not cause discomfort for some individuals, if it is accompanied by symptoms such as dizziness, fatigue, lightheadedness, fainting, blurred vision, or nausea, it is a warning sign. These symptoms typically occur because the brain is not receiving enough blood and oxygen, affecting concentration, reflexes, and increasing the risk of falls and injuries. 2. When low blood pressure is a sign of a dangerous condition. Low blood pressure can indicate serious health issues, such as cardiovascular diseases. Hypotension can be associated with heart failure, arrhythmias, or aortic stenosis. When the heart fails to pump blood effectively, blood pressure drops, leading to oxygen deficiency in vital organs. Acute blood loss, trauma, gastrointestinal bleeding, or internal bleeding can reduce circulating blood volume, resulting in dangerously low blood pressure. Septic shock or anaphylactic shock. Severe infections or allergic reactions can cause extreme vasodilation, leading to a sudden drop in blood pressure. Dehydration and electrolyte imbalance. Severe dehydration due to prolonged diarrhea, vomiting, or excessive sweating can reduce blood volume, leading to low blood pressure. 3. When should you see a doctor? If low blood pressure persists or suddenly worsens, especially if accompanied by shortness of breath, chest pain, confusion, or fainting, seek medical attention immediately to receive proper diagnosis and treatment. Causes of low blood pressure. Low blood pressure, hypotension, can result from various factors, including the body's natural physiological mechanisms, underlying health conditions, or unhealthy lifestyle habits. Understanding the causes can help us make appropriate adjustments to protect our health. 1. Low blood pressure in healthy individuals. Some people naturally have low blood pressure without experiencing any discomfort. This is a normal physiological phenomenon that does not affect overall health. In some cases, blood pressure may temporarily drop when changing positions, but it does not significantly impact daily activities. 2. The body's adaptive mechanism. When changing positions suddenly, especially from sitting or lying down to standing, blood tends to pool in the lower body due to gravity. This can temporarily reduce blood flow to the brain, causing brief dizziness or lightheadedness. In individuals with a healthy cardiovascular system, the body quickly compensates by constricting blood vessels and increasing heart rate to restore blood flow to the brain. However, in some cases, especially among the elderly or those with underlying conditions, this adaptive response is impaired, increasing the risk of falls or fainting. 3. Low blood pressure due to cardiovascular conditions. Certain medical conditions can lead to dangerously low blood pressure, including heart failure, when the heart is unable to pump enough blood to the organs; arrhythmias, an irregular heartbeat, either too slow or too fast, reducing the heart's efficiency in circulating blood; dehydration and acute blood loss. These conditions decrease blood volume, leading to a drop in blood pressure. Electrolyte imbalance. Electrolytes such as sodium and potassium play a crucial role in maintaining stable blood pressure levels. 4. Lifestyle habits that cause low blood pressure. Certain lifestyle choices can increase the risk of low blood pressure, such as eating too little salt. The body requires a certain amount of salt to maintain blood pressure. Drinking too little water. Dehydration reduces blood volume, leading to low blood pressure. Rapid weight loss. Extreme dieting can decrease blood circulation, affecting blood pressure levels. Adjusting daily habits and having regular health checkups can help manage low blood pressure effectively and reduce the risk of serious complications. When to see a doctor. Low blood pressure is not always dangerous, but in some cases, it can be a sign of an underlying serious condition. Knowing when to seek medical attention is crucial to prevent severe complications. 1. Frequent and worsening dizziness or lightheadedness. If dizziness, lightheadedness, or faintness occur frequently and worsen over time, medical evaluation is necessary. This is especially concerning if symptoms appear when changing positions or last for an extended period, as it may indicate an issue with the body's ability to regulate blood pressure. Additionally, if low blood pressure is accompanied by fainting, the risk of injury from falls increases, particularly in older adults. Seeking early medical care can help identify the cause and provide timely treatment. 2. Low blood pressure in people with heart conditions. Individuals with a history of heart disease, such as heart failure, arrhythmias, or valvular disease, should be especially cautious when experiencing low blood pressure. If accompanied by symptoms like an unusually slow heartbeat, palpitations, chest discomfort, or cold hands and feet, it may signal severe circulatory issues. In some cases, low blood pressure can indicate worsening heart disease, requiring immediate medical intervention. 3. Other danger symptoms. If you suddenly feel extremely weak, exhausted, short of breath, or notice pale skin, this could be a sign of reduced oxygen supply to the brain or circulatory failure. These symptoms may be related to severe dehydration, anaphylactic shock, or even internal bleeding. Moreover, if blood pressure drops suddenly after an injury or blood loss, immediate hospital care is necessary to prevent life-threatening circulatory shock. If you or a loved one experience any of these warning signs, do not ignore them. Seek medical attention promptly to determine the cause and receive appropriate treatment. How to manage and prevent low blood pressure. Low blood pressure can affect health in various ways, ranging from mild symptoms like dizziness and fatigue to more serious complications if not properly controlled. Managing and preventing low blood pressure depends on its causes and an individual's overall health. Below are effective measures to regulate blood pressure, categorized into 2 groups: those without heart conditions and those with cardiovascular diseases. 1. For individuals without heart conditions. Stay hydrated. Water plays a crucial role in maintaining blood volume and stabilizing blood pressure. Dehydration can reduce circulating blood volume, leading to low blood pressure. To prevent this, drink 1.5 to 2 liters of water daily, especially when engaging in physical activity, being in hot environments, or sweating excessively. In addition to plain water, you can hydrate with fruit juices, coconut water, or soups. People prone to low blood pressure should start their day with a warm glass of water to stimulate blood circulation. Don't eat too little salt. Increase intake moderately if needed. Salt helps retain water and maintain blood pressure stability. Those with low blood pressure may slightly increase their salt intake, but individuals with kidney or heart conditions should consult a doctor first. Consuming mineral-rich foods such as almonds, cashews, salmon, leafy greens, and dairy products can help regulate blood pressure. Additionally, getting enough vitamin B12 and folic acid from foods like eggs, red meat, and legumes can improve low blood pressure caused by anemia. Avoid rapid weight loss. Maintain a balanced diet. Sudden weight loss can reduce blood volume, leading to low blood pressure. If weight loss is necessary, do so gradually with a balanced diet that includes all essential nutrients and regular exercise. Additionally, eat small, frequent meals throughout the day to prevent sudden drops in blood sugar, which can contribute to low blood pressure. 2. For individuals with heart conditions. Monitor blood pressure regularly. People with cardiovascular diseases should check their blood pressure regularly to track fluctuations and adjust treatments accordingly. If blood pressure drops too low, it may be necessary to review medications, including blood pressure drugs, diuretics, or heart medications. Seek medical attention for severe symptoms. If you experience fainting, shortness of breath, acute dehydration, or persistent fatigue, seek immediate medical care. Low blood pressure in heart patients can indicate heart failure, arrhythmias, or cardiogenic shock, requiring urgent intervention. Maintain a healthy lifestyle. Avoid sudden position changes, especially when standing up after sitting or lying down for an extended period. Limit alcohol consumption, as it can dilate blood vessels and lower blood pressure. Get enough sleep, as poor sleep quality can negatively impact blood circulation. By following these preventive and management strategies, individuals can effectively maintain stable blood pressure and reduce the risks associated with hypotension. Managing low blood pressure more than just medication. Controlling low blood pressure is not solely dependent on medication, but also on diet and lifestyle habits. Individuals without heart conditions can adopt measures such as staying hydrated, maintaining a balanced diet, and avoiding rapid weight loss. Meanwhile, those with cardiovascular diseases should monitor their blood pressure regularly and seek medical attention if any abnormalities arise. Maintaining a healthy lifestyle and following medical advice will help manage blood pressure safely and effectively. Conclusion: low blood pressure. When should you be concerned? Low blood pressure by itself is not always a cause for concern. Many individuals have naturally low blood pressure levels without experiencing any symptoms and continue to live perfectly healthy lives. However, if blood pressure drops excessively or is accompanied by severe symptoms such as dizziness, fatigue, fainting, or cognitive impairment, it could be a warning sign that requires medical evaluation. It's essential to recognize that low blood pressure can result from various factors, including the body's adaptation mechanisms, lifestyle habits, or underlying conditions such as heart failure, arrhythmias, and severe dehydration. Therefore, persistent or worsening symptoms should never be ignored. To protect your health, it is crucial to be aware of your blood pressure levels through regular checkups, especially if you have a history of low blood pressure or cardiovascular issues. Additionally, staying hydrated, consuming a well-balanced diet, avoiding sudden posture changes, and managing stress are effective ways to keep blood pressure stable. In summary, low blood pressure only becomes a serious concern when it is accompanied by severe symptoms or linked to an underlying medical condition. If you experience unusual symptoms, consult a doctor promptly for proper diagnosis and treatment to maintain optimal health.